Namaste. Welcome to Kangaroo Care Hospitals. Thank you so much for joining our Facebook live show. Welcome once again to our Facebook live show about PCOS, organized by Kangaroo Care Hospitals, Women and Children Hospital at Mysore. An estimated 1 in 5, that is 20% of Indian women, suffer from PCOS. Polycystic ovary syndrome or disorder involving infrequent or irregular, sometimes it's prolonged menstrual periods, painful periods, blood loss, acne and hair loss, sometimes difficulties in conceiving. In fact, sometimes it affects in mood and mental conditions as well. All of the symptoms you experience, why we experience well-being. Today, Dr. Rashmi Kishore is here with us and she is going to guide us on PCOS and management of these symptoms. Dr. Rashmi Kishore is an obstetrician and gynecologist and professor with more than 15 years of experience in this field. She has done her laparoscopic training from Bangalore Endoscopic Surgery Training Institute and Research Center. She is MBBS, DMD and gynecology. Training also advanced training in infertility, pregnancy and gynecological ultrasound. She has gained vast experience in managing high-risk pregnancies, gynecological surgeries, including laparoscopic surgeries and management of infertility. She believes in holistic approach in managing patients. She is also member of Obstetric Society and Federation of Obstetric and Gynecological Society. A warm welcome to Dr. Live show organized by Kangaroo Care Hospitals, Mysore. Thank you, Doctor. Thanks for your valuable time. So today, Doctor, we are going to discuss few things which the young generation, the women and especially the teenagers, they go through few situations in life and they would like to discuss, and we have a lot of audience who has approached us with few questions. We are going to discuss the basic question, what is PCOS or PCOD and how do you diagnose this? How does it affect women's health?
Okay, so first and foremost what I would like to tell is why we choose this topic. Since you know September is a PCOS awareness month, and this PCOS has become so rampant, so we thought for public awareness we would start this program.
Right.
So now the PCOS is something like when a woman walks into the OPD, every 1 to 2 in 20 or 15 to 20 has PCOS or will be diagnosed with PCOS. Many times they come with signs and symptoms, or sometimes we have many criteria to diagnose. So we diagnose that she has PCOS. And now it is, it's become an epidemic like. It's a gynecological epidemic because it has become so rampant. So we call it as an epidemic only.
Okay.
And so we want to know what is PCOS.
Yeah, what is PCOS? And sometimes we don't know that I am having PCOS. How I should be diagnosed with this?
How do you know?
How do I know?
So there are two things, like one we call only PCO or PCOS.
Okay.
PCOS only polycystic ovary. So in this, like the woman or the girl, she may not have any signs and symptoms.
Okay.
But she would have done a scan as a routine scan, or when she's doing for some other problem, she would have got a pelvic scan.
Okay.
And there they would have given us polycystic ovaries.
Okay.
So this is called PCO.
Alright.
And next is PCOS. PCOS is polycystic ovarian syndrome.
Okay.
Syndrome means it's a group of symptoms.
Okay.
So here we call it as PCOS. Then how do you diagnose this? How do we diagnose? We have
like what are the symptoms, doctor?
Okay, symptoms. Yeah.
If we we want to understand that I might have PCOS, right? What are the symptoms we can refer to?
Okay. Symptoms mainly menstrual irregularity.
Okay.
This is the main symptom women will present.
Okay.
So it can be delayed cycle. Most of the time it is delayed cycle.
Okay.
They will have like once in 1.5 months, 2 months, and sometimes they might not get periods until they get some medication.
Alright.
Sometimes it can be delayed up to 5 to 6 months also. And many times in married women, they would have got confused thinking that they are pregnant because they would have increased weight and mainly the belly weight. So they would think they're pregnant, but actually they have PCOS. This is one of the main symptoms. And another commonest symptom is putting on weight.
Alright.
And they would tell the doctor, I'm not eating much, I'm exercising, I'm going to gym. They calm that they'll be putting on weight. Actually, it is not right.
Okay.
It's like maybe they have something wrong with their diet, something wrong with the like daily routine activity, and it is like a vicious cycle. They don't get cycles, they put on weight. They put on weight, they don't get the cycles. It's a vicious cycle. It's got to break it somewhere.
Alright. This can be confused, right?
Yeah.
They might think that I'm just putting on weight, maybe I'm eating too much or junk food or something like that.
And one of the common things is they feel because they're not getting insulation, there are many toxins getting accumulated in their body.
Okay.
They feel like every cycle they are putting out the toxins out.
Okay.
Something abnormal things are in the uterus, they're putting it out. So they're not getting this periods, they think, oh, that's why they're putting on weight. But actually it's a different mechanism. The second most common thing. And they'll have symptoms of, we call it as hyperandrogenism.
Okay.
That is excessive of male kind of hormones.
Okay.
So they'll have acne, mainly on the face, upper chest, upper back, these areas. And increased hair growth, we call it as hirsutism.
Okay.
And this kind of hair is not the thin hair what usually girls have. Then have a thick tuft of hair, like a male kind of hair growth. On the upper chin, on the upper lip, on the cheeks. And sometimes they'll have the chest, upper back, and lower abdomen and thighs. And we grade this according to some criteria. We have also some criteria, so we grade according to that. This is one of the common symptoms.
Okay.
And some will have excessive loss of hair. And they'll have this male type of baldness.
Okay. So that is also associated to PCOS.
Yeah, because they have more of male and hormones, androgenic hormones.
Okay.
So that's why they have loose hair. Because girls are supposed to have more of scalp hair, right, compared to male. So when they, from these female kind of hormones, when they shifting towards this male kind of hormones, so they tend to have more of this kind. I'm not speaking anything too scientific because it's a public awareness program.
Absolutely. Like, the main thing is that the young generation, especially our program, is dedicated for the young women and the teenagers. So teenagers sometimes they feel very embarrassed. Like I got few questions from audience. They're saying that I feel very embarrassed because I'm having hair on my face, and then too much of acne, which is like uncontrollable, and hair loss.
And they get their esteem also down.
Exactly, because they're so young, and there is a
and they'll be comparing with their friends, and they'll be thinking, oh, you have so many acne, why don't you do something?
Right.
And this brings their esteem also down in their whatever profession or in their educational field. These are the commonest symptoms the PCOS we present with. And we just don't clinically, we diagnose all symptoms, but we have a lot of signs also. We have a few criteria. The commonest is the Rotterdam criteria. Then we have Escherich criteria. Then we have NIH. The most commonly used is Rotterdam criteria. And this is, I know, a bit scientific, but I think a little bit also I should.
That's the clinical part of the.
Because I have seen in OPD, so they come with the scan report. And scan reports doesn't say they have PCOS. Doesn't say. It's ovaries are normal. So when I say no, you have PCOS, they don't want to believe me. They say no, doctor, the scan is normal. How can you say? So that's not the only criteria. So mainly, like clinically, how they come of oligovulation and anovulation. Oligovulation, like as I mentioned you, they have very irregular cycles. So physiologically, like lady will have ovulation and she will have a regular cycle. So when she doesn't ovulate, she doesn't have cycles. Or irregular cycles. Or she might ovulate just 3 to 4 times a year. She may not be ovulating all the 12 cycles. So that time she'll have once in 1.5, 2 months, 3 months like that.
Usually it's supposed to be every month the cycle has to be completed.
So this we call it as oligovulation, and sometimes they don't ovulate at all. Just the estrogen just accumulates, and just like a withdrawal bleeding they'll get once in 2 or 3 months, and these bleeding will be excessive. But some will have very scanty flow also, they may not have. So bleeding can be, either it can be scanty or it can be excessive, any of these. So this is one thing, and we have biochemical and clinical criteria
Okay.
of androgen excess.
Alright.
So once I already told about technique, that itself shows that they have more androgenic hormones.
Okay.
And like how do we prove biochemically? There are few tests like that tests we have, and we see the levels of male hormones in that,
Alright.
and increased LHF saturation, we call it luteinizing hormone and follicle stimulating hormone. Because I'm telling you, because nowadays girls, they know many things.
Alright. Because they are going to school and colleges, they are aware of, but sometimes they don't, they can't relate with.
And also they would like to know like what kind of hormone is going wrong with them.
True.
It's not like before 10 years before you tell them something, they will say okay and go.
Right.
Usually they will know what's happening with them, and they would have said something about hormones. Usually some science students.
Yeah. In our school, college also, we have gone through a little bit of hormonal things, but we
Yeah.
don't know how it plays actually in life and life.
But nowadays girls are quite smart. They know like few things about their body and about hormones.
Alright.
So there is a variation on this. So we see all these criteria, and of course the image.
Okay.
In image, what happens? This ovary becomes very big, enlarged.
Okay.
When they measure, it will be usually more than 10 cc. We have a measurement for that.
Right.
10 cc, and there are a lot of small follicles in the peripheries of the ovary. And we have a name also for that, necklace pattern.
Okay.
Fancy name we want to that because it looks like that. Periphery of the ovary, there will be very small follicles. And the problem is with these small follicles, to ovulate, one of these has to become dominant.
Okay.
And they will have ovulation. And none of these become dominant. And they don't ovulate. So hence they don't have a periods. They don't have a cycle. This is one of the things. So depending on these criteria, we diagnose them. Why I was telling is there are obesity I was telling. But there are few girls whom we call it as lean PCOS. So they'll be very thin, that BMI is around 18 to 20. They're not obese at all, but still they have this oligo-ovulation and ovulation. They might be having hirsutism. And to be frank, these kind of patients are a bit resistant to a treatment also. The lean PCOS. Obese patients
it's not very much visible.
And they think I'm not obese. And one more thing, when they're lean, they feel they don't want to put it right. Because they're thin, they feel they can eat whatever they want. They're not putting on weight, having junk and white food, all that.
Okay.
So these are the criteria we see, and we diagnose as PCOS. But there's one more thing I've seen, like when girls attend puberty, for 1 or 2 years they may not be regular having periods. So that time they don't have to panic.
Should not be confused with PCOS. Okay.
Because as soon as they attend puberty, there's something called HPO axis.
Okay.
That is hypothalamus pituitary ovarian axis. It will take some time to set.
Okay.
So till then they may not have regular cycles. So that's one thing. When they come,
we should know.
We don't try to investigate them.
Right.
But nowadays kids are really obese. So, but we usually tell them to go for proper diet and physical health, because later they might become PCOS.
Okay. That's interesting, doctor. We got to know that PCOS will give you some symptoms in different ways. Either it will be irregular menstruation, or maybe obesity, or you can see acne on your face, or unwanted hair growth. These are the signs and symptoms that I might have PCOS and I should go for a checkup, right? And as you mentioned also that the young girls, when they go to their puberty, we should not be confused with PCOS. However, it's better to
seek a gynecologist and make sure. And also it is for them like, okay, my daughter is not PCOS, it's kind of puberty thing.
At least that safety.
Yeah.
Okay, that's great. So doctor, we understood what is PCOS and what are the signs, we will get it. Now, how does it actually affect in women's health?
Okay. See, as I told you, one is psychological and the physical both.
Alright.
Psychological, as I told, obesity.
Okay.
Obesity, I don't have to tell. Nowadays, girls, they want to maintain the zero figure, whatever thing. And when they're obese,
as well as healthy also.
Healthy, that is there. Healthy is most important. Obesity is mother of all diseases.
I know.
So that is one thing, and as I told you before, it gets their self-esteem down. That's one thing, and having that hirsutism. This is one part. This is their daily routine mental thing. The other thing is coming to the medical part, how it affects.
Right.
So when they have PCOS, as I told you, they have irregular cycles, right? So there is kind of male androgen, like male hormones accumulated, and this shouldn't be there with females, right? So what habits going to affect? So one thing is, and also I would like to tell what are the causes of PCOS. That's what people also want to know.
Right.
Like today only one girl came to my OPD and told doctor she's quite lean. She is maybe around 50 kgs, and she told me, doctor, I don't have like my mother told me that she didn't have PCOS and grandma didn't have, and how do I have PCOS?
Okay, that's a question.
If you look at her, none of these symptoms, except that she's Mr. Period. Okay. No acne, no asceticism, no obesity, nothing. So there is also genetic component.
Okay.
So, but if I say genetic, then she would ask like my mom didn't have, my grandmom didn't have, like maternal aunt didn't have.
Okay.
Yeah, but what they were eating is very important. What kind of food they were having. Genetic component is there, but probably it is not expressed.
Okay.
Actually, it is autosomal dominant, but many a times because of their good lifestyle, good diet, it was not expressed. That is one thing. And one more thing is we call it as there's a chronic inflammation. Chronic inflammation is not like when we have some infection or something. This could be because of like physical stress or mental stress. More than physical stress, nowadays what I feel is mental stress.
Because in school, college, or even in office going, people are also
Everywhere.
have to manage everything. Okay.
And people are so demanding in each field.
Right.
Wherever you go, they demand. Whichever field. And one person demanding other, that person demanding
It's cycle of stress.
And nowadays you would have seen even in schools what all they give projects and to be frank, like my kids what they're studying the biology, I studied in MBBS.
Very true. Like one way we are actually very advanced. At the same time, we don't know how to handle the stress which is affecting us.
See, I don't know there's a competition for the kids or the schools or staffs. I really don't understand. So what I feel, in case if they join MBBS, what will they study? Because
we are very advanced.
Really?
So I think in other way it is very important that all the audience at the age group, they understand their body, they understand their situation. So I think if we are aware of PCOS, we can actually handle very peacefully like this. Great, doctor. This is really very eye-opening. You are giving some insights that all the young generation will have a hope and they can handle their health very well. Great. So we understood now what is PCOS and how one can know that I am having PCOS or that related symptoms and how does it affect my regular activities and life. Great. So doctor, we would like to know when should we seek medical help? What are the treatment options for girls we are having, those who are having PCOS? Like when?
So it's like you come as early as possible. Okay. Don't delay.
Right.
You start because PCOS, as I told, there's a lot of androgen hormones accumulation. Okay. And once it starts, it just goes on. Okay, and then start putting on weight. To get that weight down is not that easy.
That's very
as I told, there's because of chronic inflammation, there is something like fasting insulin will be raised. Because I'm telling you this because you would have advised them to do fasting insulin.
Right. So
they should know why I'm not diabetic, why doctor is talking about fasting insulin.
Okay.
So in PCOS what happens, this fasting insulin is very high. Okay. Why? Because whatever this insulin is secreted from beta cells, right? And it is supposed to take up the glucose for the metabolism. Okay. Here it is so resistant that it doesn't take up glucose for metabolism and glucose is accumulated. And because there is more glucose in the body, again it is stimulus to produce more insulin. So the insulin level will go on increasing and further again this will stimulate the ovaries. Okay. Insulin and glucose levels. Right. And ovaries become very thick and very androgenic and we call it a stroma. Okay. That will be increased and producing this. This is one thing. So if they come early, we can tackle them early. Okay, we'll start the treatment. And coming to treatment aspect, you want to talk about treatment?
Yes. So, what are the treatment options? What are the options the girls having, those who are actually suffering due to PCOS or with this kind of symptoms?
Okay. Let us not call it as suffering.
Okay. Yeah. Exactly.
Girls will feel bad.
Right.
Okay. PCOS is I don't know, what I see is it's kind of lifestyle modification. Let us not, because see, before we used to call it as polycystic ovarian disease.
Okay.
Now they change the terminology. Yeah, because they don't want to do it as a disease. So, but PCOS is like you have a good lifestyle, you're going to be alright. You change your lifestyle, again you get PCOS. So they will come to the OPD and tell, Doctor, I had PCOS, now I don't have. Did I get again? Am I going to get again? Yeah, any time in their life they can get.
Okay.
So first, what is the treatment? I'll tell you 50% of the treatment is the patient or the girl. Let me not call it as a patient first. Or the girl or the lady. So what is it I'm telling 50%? Usually when they come to us, we give all the treatment, right? But here it's different. 50% is with them. So first and foremost, what we do in PCOS is lifestyle modification. So in lifestyle modification, we have two things. One is diet and one is the physical activity. And when you come to diet, you tell them, Doctor, no, I'm taking, what is it? They take this lime juice, lime with honey.
Right. For obesity, I think we do few things without knowing.
Okay. Yeah, and if you're taking stop it, you can have no problem. Lime with honey. And do it in the morning, like take only oats or cereals or something like that. And crash dieting. And they don't eat in the night. And some will say, no, I go to gym every day, whatever, some kind of workout. So what they do, just because they're going to gym, they feel they can eat anything.
There is a need. True.
Yeah, because I'm working out, so I can have anything. That's not true actually. So what you have diet is very important. In that, people will say that, okay, they want to go to YouTube and pick up one diet and follow that. So you don't have to do that. You just modify whatever you're doing. Okay. For a South Indian who is used to ragi and rice, I cannot tell them directly you change everything and go back to wheat. And some people they're used to only wheat. You cannot tell them no, you come and eat ragi. It's not true, right? I mean, it's not possible also. So what we tell is mainly low carb and high protein. Doesn't mean you take up the whole carbohydrate. Just have having less of coconut in your diet and less of oil and avoid all kind of deep fried items. And this we call it as white foods, right? Like bread and pasta. This is a new thing, because there are
so fast life, people want to just cut short everything.
And there are so many new restaurants, they want to try everything. Because they will ask you to go to that restaurant, it's very tasty there. Then the girl will be, no, I didn't.
The young generation is into that actually.
I didn't try that.
To explore many things.
Let me go there. Yeah, let them do it, it's their time.
But moderation required.
Yeah, once in a while. But every day their diet, that's what. And not to be fascinated much. You know, I remember like few years back, there was a thing that don't have ragi. Ragi is not good. And use brown rice. Don't have wheat. Wheat is also not good. Use brown rice. Why? We have been eating wheat and things since a long time, right? And also like modification. If you are using rice, don't use polished one. Take a part. It gives you all vitamins and you don't put on weight also with that actually. Absorption time also is less. So the glycemic index is not raised. And even though I'm going to have more on that because this is what the public want actually. And like if you're taking fruit, try to take the whole fruit, not the juice. Because you put sugar. Even though you don't put sugar, there's no fiber in it. And avoid our canned foods, preservatives. And nowadays the packed with foil, silver foils. All this will give rise to PCOS. And also using a lot of chemicals even at home. Air freshener everywhere. And a lot of perfumes and all preservatives. Try to take, fresh, more fresh. More as possible and using other chemicals also. Like nowadays, I've seen like patients they come telling that they use vaginal wash regularly. We have so many things in the market, which is hygienic ones on the TV or something. You don't have to do that because it balances its own pH. This again will be raised and using like panty liners. These are not really good. These are kind of chemicals which will stimulate and chronic inflammation. The small things, but it's quite
a lot of information actually we are getting from you, doctor, today.
Very important. That's why I tell you 50% is with you, the treatment.
Oh, that's lovely. Actually, sometimes we feel that rightly you have corrected me that don't call it suffering, because we are not suffering. These are the few options and few situations which is happening due to hormonal changes. And as Doctor rightly said, it is in our hand. Lot of things we can modify, moderate instead of just the hard and there is nothing hard and fast rule also as well.
Yeah, it's very easy.
It's just a balanced life and balanced
and also
life.
the exercise. Just the diet and they don't exercise. 45 minutes walk they have to do, and they don't have to go for fancy gym or something like that. And around 30-45 minutes kind of stretches or core exercise or yoga, whatever they want to do.
Right.
Do
Some activities religiously we have to follow. Okay, that's really great. Like, it's really a hope Dr. Rashmi is giving us that you are not suffering. You have a lot of options, and it's within your territory. You can do a lot of modification and change in your life. And the young generation, and maybe especially the teenagers, are well aware of these situations, and you can handle very well. This is really very, very interesting, Doctor. So, Doctor, we have few more questions from our audience. That as you already guided, like the girls can do a lot of things to change themselves.
Yes.
Now, would you give some light, like? Is there anything that girls with PCOS can personally do to help themselves?
Yeah, the same thing, lifestyle modification. Just the first and foremost, as I told.
Right.
As I told, 50% treatment is with them. 50% is what we do.
Right.
This is what we also get being taught from our teachers.
Right.
And this is what we follow every day. So that's it.
Okay. So is there any diet restrictions or lifestyle modification immediately which we immediately start if you are getting this kind of symptoms?
It's the same thing what I told. They have to, like, every human being for that matter should have a good lifestyle.
Right.
So I tell, don't worry, you have PCOS. It's teaching you to have a good lifestyle.
Right. Okay.
Because the later complications are very important in PCOS.
Right. Okay. So like later complications, what you have just now suggested. So PCOS may have difficulty. Like, what are the long-term effects of PCOS? Like, how we should handle that?
Long-term effects mainly because of obesity. And this PCOS patients in long term they tend to develop diabetes.
Okay.
So maybe during their pregnancy, and they tend to have a lot of cardiovascular problems later.
Okay.
So to have a good health later in their life, maybe in the 40s or whatever, it's better they have a good lifestyle from now on itself.
Okay. Okay. This actually is very interesting. That we thought it's only up to acne and hair loss and all these things, but you said no, it's not that. Okay. That long term.
Lot of implications. Even during pregnancy, people can have a kind of problems in PCOS.
Right. Okay. Okay. So yes. So along with this question, there is one more question from our audience, that PCOS may have difficulties in conceiving, which few people are actually facing this problem. So what would be your suggestion in that case?
Yeah, PCOS, not everybody. Some people you would have seen they're quite obese and they would have conceived without any problem. So not some are very thin PCOS, they wouldn't have conceived.
Right.
That's why I tell you PCOS has to be treated from the beginning.
Okay.
As
soon as you get
it could be lifestyle modification or medical management.
Okay.
Surgical management usually only in few times we need.
Yeah.
So coming as I told, the lifestyle modification already I discussed. Then next is about medications. What medications we give? We have something like myoinositol, then metformin. Metformin is given in diabetic also.
Okay.
So the patient, I don't take me out of patient in that. So they will think I'm not diabetic, then to we are giving that. As I told you, there's a lot of insulin resistance in PCOS. So this metformin will take care of that. And we give hormonal pill.
Right.
Again, they don't have to worry that I will put on hormones.
Right.
Because nowadays we have very low dose hormones. In fact, we call them as ultra low dose.
Okay.
So there's no harm in taking this hormonal pill actually.
Right.
So usually we give them for 3 to 6 months, sometimes maybe 1 year also. So these are the medical management what we do. Actually, they have a benefit from this hormones.
Okay.
So as I told you in PCOS, there is a lot of hormonal irregularity, right? So what we do when we supplement this hormonal pill, the ovaries will go for rest.
Okay. Because it's struggling, actually, you say sometimes inflammation.
Yeah. So ovaries will go for rest. Okay. And we are controlling the hormones from outside.
Right.
So when you start working, so it is like calm down. It works better. And also this hormonal pill will protect your breast, having kind of breast tumors and all. No? It has a protection over that. So that's one thing I would like to tell, that they don't have to worry that somebody is prescribing hormones.
Okay.
These are managements what we do.
Yes, because a lot of people, they are very scared of getting hormonal treatment. They say that, I can get a dependency on this.
Yes.
Or is there any harmful
If
side
something like
effects?
their periods become irregular anytime they go and taken hormone that time, or if they don't conceive, they tell, oh, they're giving me hormones, that's why I'm not conceiving. Actually, it's not like that. Actually, good that given them hormones.
As you rightly say that, it protects from breast cancer or breast tumor and all those things we can protect.
Yes.
Yeah. Okay. That's really very wonderful. So, Dr. Rashmi, what would be your message? Since this is, as you mentioned, that September month is actually PCOS Awareness Month. So, in this special month in awareness program, what would be your message to the larger audience?
Lifestyle modification, that's it. Yeah, and whenever you have a problem, please seek your gynecologist as early as possible.
Right. That's really very interesting. Thanks to Dr. Rashmi for giving us her valuable time to understand how we can easily diagnose and treat PCOS. Kangaroo Care hospitals provide the best PCOS health checkup, which will help you to diagnose and treat based on the symptoms. As doctor mentioned here, the symptoms might be visible, may not be visible, and sometimes we get the hints what exactly happening inside your body, and listen to your body, and whenever you feel this kind of discomfort, without any hesitation, please seek attention of your gynecologist. So thanks for joining our show. See you in our next show with more interesting topics on women and children health. If you wish to have any specific discussion on our show, please feel free to drop your message. We would like to address your concern. And especially, once again, thanks for joining our live show. Namaste. Thank you, Dr. Rashmi.
Thank you.